Hello my dear friends and colleagues. Let us continue the discussion of amenorrhea. Let us see the causes of hypothalamic amenorrhea. The most important cause is the weight loss. Second is exercise, excessive exercise. Third is genetic, that is Kallmann syndrome. Constitutional cause of amenorrhea. Idiopathic. Let us see how weight is responsible for amenorrhea. If there is history of weight loss, we have to see the cause. It can be because of excessive exercise, self-induced starvation like the eating disorders, chronic illnesses. We have to take the history regarding this. We know that 20% of the body weight should be made up of fat for the maintenance of the normal hypothalamo-pituitary ovarian axis and normal menstrual cycles. So if there is a loss by 10 to 15% in the body weight, it causes amenorrhea. What is the treatment of this? We have to see the underlying cause of amenorrhea in this. We have to have a dietitian, that is nutritionist input, a psychiatrist input in this, and correction of nutritional deficiencies, electrolyte deficiencies, and refeeding syndrome. The ovulation can be induced by gonadotrophins and menstruation can be induced by oral contraceptive pills. Now let us see the constitutional cause for primary amenorrhea. In this there is a positive family history in the mother and sisters. There is short stature, delayed secondary sexual characters, and delayed epiphyseal maturation, which is suggested by the hand X-ray bone aging. In this, other causes have to be ruled out first and puberty has to be induced. Now let us see the idiopathic hypogonadotrophic hypogonadism. In this, the cause is unknown as the name suggests. So how we are going to differentiate it from the constitutional delay? It can be differentiated once the estrogen therapy is withdrawn on completion of pubertal development. In this, there is defect in the development of the gonad or the functioning of the gonad by some central mechanism. The third cause is the chronic illnesses like chronic debilitating conditions. They can affect the functioning of the hypothalamo-pituitary ovarian axis. So a good history has to be taken for poor nutrition and malabsorption syndrome like celiac disease and inflammatory bowel disease, and they warrant specific treatment. History of childhood cancers with cranial irradiation can also lead to pubertal failure. The next cause is space occupying lesion of the hypothalamus. These are the tumors in the brain and they tend to occur around the time of puberty and cause amenorrhea by disrupting the hypothalamo-pituitary ovarian axis and tonic inhibition of dopamine on the prolactin release, or they can directly compress or they can destroy the hypothalamic or pituitary tissue. They are likely to present with other concerning symptoms like headache, visual field defects, and evidence of other pituitary hormone dysfunction in the form of galactorrhea. The treatment involves cranial imaging, inputs by neurologist, neurosurgical input, and the treatment involves invariably destructive therapy in the form of surgery and or radiotherapy, and subsequent hormone therapy is needed depending on the resulting deficiency. The next cause is Kallmann syndrome. It is a genetic condition. It is very rare condition. 1 in 50,000 is the incidence. It is associated with delayed puberty, hyposmia or anosmia. The male to female ratio is 4:1. 50% are genetically inherited in the form of autosomal dominant inheritance or X-linked recessive inheritance. Less than 10% are related to mutations, that is NOS1 or FRGR1. Kallmann syndrome is a spectrum of genetic and phenotypic variations. It is associated with other abnormalities like unilateral renal agenesis, abnormalities of the bones, fingers, of the toes, cleft lip, palate, hearing loss, color blindness, infertility, osteoporosis. So treatment is by gonadotrophin treatment and they may need artificial reproductive technologies. If you like the content of this channel, please subscribe to my channel and don't forget to hit the like button and share with your friends and relatives. Thank you very much.